All right, hey, Dr. Don, welcome back to the channel. Now, as you can see by the topic of this video, we're going to be discussing hypothyroidism, something that affects so many women. It does affect men as well, but it does favor women something like 24 to 1. So I do work with a lot more women that are dealing with low functioning thyroid or low functioning thyroid symptoms. Which honestly is a huge difference. And so we're going to dive into that. But before I dive into the actual content of the video, I want to start off with a little story, right? Everybody likes a story. So this story is about a young lady that's in her later teen years. So when she was like 16, 17, 18, she started to develop some symptoms of hypothyroidism. She just felt like it was really hard to get up and get going in the morning. Getting through college was really, really tough. She was doing graduate work at Ohio State University. And so, she just told herself that I'm so overwhelmed with school and I've got so much going on with cheerleading and all kinds of things that I'm involved with. That's probably why I'm fatigued. So, long story short, she gets through college. She meets a gentleman on spring break, in her senior year. They end up getting married. They have a couple kids now. When the second child was very, very young, that her first husband left her. And so she was a single mother for a couple years. Very, very stressful situation. This was she was raising these kids in the Bay Area, and so it's very stressful, very expensive place to live. Finances were always an issue. She was working two different jobs, just doing everything she could because she wanted her boys to have everything, and so she was very, very stressed. And so as these years went along, more and more thyroid symptoms came on. So she finally got to a point, she went to the doctor, and she went to her doc, and kind of how it went was, doc, these are the issues. She was dealing with things like constipation. She was dealing with things like hair loss. Fatigue was one of her main symptoms. The outer thirds of her eyebrows, she started to notice, were starting to go away. So the doctor said, no worries. It sounds like you have some issues with your thyroid. Let's run some basic labs. So they ran TSH. Back then, that's really all they ran. A lot of times, unfortunately, now even in these days, that's all they're running. But they ran the TSH, which is thyroid stimulating hormone, comes from the brain, tells your thyroid what to do as far as how much thyroid hormone should be secreted. That number came back very high. So with the conventional testing, when the TSH comes back elevated, they diagnose you with a low functioning thyroid, and they go ahead and do what they normally do. They started her on Synthroid, which is a T4 thyroid hormone replacement. And so, they was told to come back in 3 months so we can recheck your levels. And so she did so. She went back in 3 months. And what happened was, and this is really where the frustration started with this lady, is all of a sudden her TSH was normalized. Her tests were normalized. But what she kept telling the doctors was, my symptoms are not going away. Matter of fact, year after year, as this testing continued to be normal, more and more symptoms arose. And so what happened was frustration after frustration, right? So kids are growing up. She got remarried to the love of her life. This gentleman loved her boys. They actually had another child. So as life went on, things got better. Stress got reduced. The kids grew up. They got out of the house. They were all three very successful kids. And now she's dealing with all these symptoms. She's been on thyroid medication for years, but she always blamed it on stress. She always blamed it on the financial stress and how she was always so busy, and she didn't always have the time to eat perfectly, and there's just all these things she blamed how she felt. And so now at lower mid 40s, younger to mid 40s, she's very overweight. She's fatigued. She has a bowel movement maybe once a week. Her hair is very, very thin. She's got mood swings. She's very sensitive to cold temperatures. Now she's developing a lot of arthritic type symptoms. Her joints are bothering her a lot. Brain fog is setting in. So she's got all these symptoms. She's going to her doctor every year. Her doctor says everything is normal. So she becomes very frustrated. Well, fast forward about 10 years, one of her sons, which is me, all right? So this is a story about my mom, but one of her sons, me, went to school to be a chiropractor. Graduated from chiropractic college. I wanted to know more about helping people with metabolic conditions, with these chronic illnesses that medicine just doesn't have a lot to offer. So I got my diplomate in functional medicine, studied functional endocrinology, clinical nutrition, a lot of Chinese medicine and herbal medicine. So when I got to my mother, somebody that ran 5 days a week, which, running 5 days a week, 4 miles every day is something that could have been very detrimental, and it was detrimental to her health at that time. But she ran all the time. She ate really, really good. She was overweight. She had all these symptoms. Her tests say she was normal. Within 6 months of working with my mother, she lost 80 pounds. Her hair started to grow back and thicken. She was having normal bowel movements. My stepfather, which is, I consider the guy that really raised me, he looked at me and said, this is the woman that I married. I got my wife back. And so this is a story that a lot of women that are going to watch this video, you're going through this journey. It's one day after another. It's more and more symptoms. Your doctors are telling you you're crazy. Just like my mother, they wanted to put her on cholesterol medication. She refused. They told her she was just depressed, wanted to go on depression medication. She refused. They wanted to go on arthritic medications because all the joint pain that she was having, she refused. So she was miserable. She was dealing with all these symptoms. And so in this video, I want to give you guys hope. Those of you that are dealing with these symptoms, you've been told everything is normal. You've been told you're crazy. It's all in your head. I'm telling you it's not. See, there's so much more to thyroid than just TSH. There's so much more to thyroid than just your T4 levels. There's also so much more to thyroid function than what your T3 levels are doing. And so, a lot of you watching this video, what I've found is most people that I get in touch with, they've already done a lot of research. And so about your TSH levels and your T4 levels and your T3 levels. So what if those are being tested? And what if those are normal? So that's what I want to dive into in this video. I'm going to give you guys a lot of tips, a lot of things that you can start looking at and thinking about in order to get rid of your symptoms and help you, live a life without thyroid symptoms, which can be very, very detrimental. All right, so let's dive in. All right, so let's talk about the symptoms of hypothyroidism, also known as a low-functioning thyroid. A lot of people are put on thyroid medication. They don't even know why. So if you're on levothyroxine, if you're on Synthroid, this is a hormone replacement. I had a gentleman I was talking to the other day. He said, I'm on lymph node medication, and he was on levothyroxine. So a lot of your doctors aren't really educating on what you're taking. We're going to talk about the physiology. We're going to talk about the pathways that in order for you to get down to why you're having the symptoms that you're having, you first have to understand the pathways of how your body actually utilizes the thyroid hormones. As you're going to see, when I go through a list of symptoms, it affects many different systems in the body. And the reason being is because every single cell, and this is very rare, but every single cell in your body has a thyroid hormone receptor. And so there's many hormones in the body and they affect different systems of the body, but the thyroid hormone affects every system in the body. And that's why the list of symptoms, I'm going to go through a list of some of the classic symptoms, the more common symptoms that we see. But again, there can be so many symptoms from somebody that's affected from either a low functioning thyroid or the inability to use those thyroid hormones in the body, because it does affect every single cell, from your brain cells to your thyroids, not your thyroid cells, to your ovaries, to your adrenal glands, to your pancreatics. I mean, every single cell in your body is affected by the thyroid hormone. So some of the classic symptoms that we see obviously is fatigue. Okay, fatigue is a very, very classic sign of low functioning thyroid. Also constipation, right? Everything just starts to slow down. The inability to lose weight or even weight gain, okay? Dry skin, thin hair, brittle nails. A lot of times the outer third of the eyebrow starts to fall out. Now, it can definitely affect the throat from different reasons why we're going to talk about later in this video, but you can get more of a hoarse voice. You can get swelling in the throat. You can get goiters on the thyroid, enlargement of the actual thyroid gland. It can affect your menstrual cycles. We can see a much heavier flow, or we can just see irregular cycles. Many, many different things. We can see puffiness in the face. We can see joint pain because, again, it's a very inflammatory process that causes the low functioning thyroid in most cases, which again, we're going to talk about. Hang in there with me. But again, it can cause inflammatory issues like swelling and joint pain, body aches and muscle cramps and things like this, brain fog, right? So again, there's so many different symptoms when it comes to a low functioning thyroid. And so more times than not, guys, listen, it's not in your head. I know your doctors are telling you you're crazy, just get on depression medication, you're depressed, your mood swings, just do things to help deal with the mood swings. It's just you just need to relax. You're stressed out. Well, yes, I am, but there's something underlying that's driving these symptoms. There's something that's causing the thyroid problem, because here's the thing. Most of the time, it's not a thyroid problem, meaning your thyroid is doing what it should be doing, but your body still has all these low functioning thyroid symptoms, right? There's cases where people come back and the limited testing that's being done on them shows that they have a high functioning thyroid, but yet they have all low functioning thyroid symptoms. And so at some point you have to dive deeper, okay? And so let's talk about that, because again, in order to be able to dive deeper, in order to really resolve these issues these women are having, and the reason why I've had such great success with helping people with hypothyroidism is because you first have to understand the pathways, and then when you understand the pathways, you're able to do some more in-depth testing to really find out exactly what's driving these low-functioning thyroid symptoms. All right, guys, let's talk pathways. So, we're going to talk about a cascade of events that occurs in order for your body to secrete the thyroid hormones, activate those thyroid hormones, and then go ahead and bind those to your thyroid receptor sites so that your cells can utilize that thyroid hormone. So again, it starts in the brain. Obviously, all communication starts in the brain with your nervous system. And so the hypothalamus is really the communicator between your nervous system and your endocrine system. And so the hypothalamus secretes a hormone called TRH, thyrotropin releasing hormone. That thyrotropin releasing hormone then travels to the pituitary gland. Then the pituitary gland, based off of how much of that hormone is secreted, will secrete TSH, which is thyroid stimulating hormone. Okay, and obviously based off of that name, that hormone then travels to the thyroid and tells the thyroid to go ahead and secrete T4. And again, it mainly secretes T4 hormone. It does also secrete some T3 and what's called reverse T3. Reverse T3 is just when the tyrosine are bound backwards. That hormone really is ineffective. So when you start to see high reverse T3, again, really tells us there's a lot of inflammation within the thyroid gland. It's making the hormones backwards basically. But the majority of the hormone that is secreted by the thyroid is T4. Now, T4 is also the replacement more times than not synthroid, levothyroxine. In some cases, they do give you T3 hormone, things like Cytomel. Again, we're going to talk about why you would have normal T4 and not enough T3. Okay, a big part of why you're having symptoms. But again, mostly T4 is secreted. Now, that binds to a protein. Okay, proteins are like taxi cabs in the blood system, kind of like LDL is a low density lipoprotein. That is the taxi cab to take cholesterol from your liver out to the body to do all the things. And so thyroxine binding globulin, TBG, is what binds to that T4 and allows you to now take that T4 to mainly your gut, some in the liver, a little bit in the lungs, but mainly in your gut, to where now you're activating that T4 into T3. And so T3 is the moneymaker, if you will. That is the active form of your thyroid hormone. Now T3 then travels to the cells. Again, remember, every cell in your body has a thyroid receptor site. And so that T3 has to bind to that receptor site in order to get inside of the cell so that everybody's happy. Your body's now utilizing thyroid hormones and your body is functioning the way it's designed to function. Now, let's go through each pathway and talk about where the dysfunction is. Because again, there's a reason why you're having symptoms. And in order for you to be symptom free, you have to be functioning normally. And in order for your body to function normally, you have to go through all those cascade of events to where that active T3 can bind to the thyroid receptor site, get inside your cell, where all that metabolic activity happens. Okay, and so again, let's dissect the different pathways to find out what's the problem. Okay, so again, let's start at the top. Hypothalamus and really pituitary function. And so the hypothalamus communicating with your pituitary gland, and then the pituitary gland secreting TSH to communicate with the thyroid. And so, what's going to affect the communication between hypothalamus and pituitary gland and your thyroid? Well, these are in your brain, and so things that we see more commonly that affect these hormones released by the hypothalamus and the pituitary is, number one, brain trauma, concussions, chronic concussions, multiple concussions, things like that definitely can affect the release of those hormones. And then in more rare cases, things like radiation treatments, different kind of surgeries, tumors on those glands can definitely affect the release. But less common, okay, way less common from the population that I've worked with over the last 9-10 years. Less common do we see issues there. More commonly, we see the issues after the thyroid secretes the thyroid hormones. And so, let's talk about the type of testing both you guys are having. And that's one of my biggest pet peeves, really, with a lot of different conditions and how they're treated by the medical world. But specifically hypothyroidism, they're looking at your TSH. Again, brain hormone tells the thyroid what to do, not even a thyroid hormone. In most cases, they're diagnosing you with a low functioning thyroid only by testing that hormone. A lot of times nowadays, especially if you've moved and progressed to seeing an endocrinologist, they're most likely going to run your T4 levels. And so classic presentation of a low functioning thyroid, we see a high TSH and we see a low T4 in the basic blood work that you're looking at. They say that your pituitary gland saying, come on thyroid, we need more hormones. And obviously the T4 levels in your blood are low. Okay, so rare case, honestly, rare case, you have primary hypothyroidism. Primary hypothyroidism means that your thyroid, and again, there's different causes of this, from iodine deficiencies to stress to trauma to different things, but your thyroid gland itself is not producing enough hormones. So your pituitary gland is increasing the release of TSH because the T4 levels are low. So you have a feedback mechanism. And this is the reason why many women out there, the majority of women that are taking thyroid hormones, your tests are normal, but you still have symptoms. And so why does the TSH normalize and the T4 normalize when you start taking medication? Well, the reason why T4 normalizes is because you're taking artificial T4. You're taking that hormone in, so obviously you're going to have more show up on your blood tests. So now your T4 levels have come from low up to normal. But how does it normalize the TSH? Well, what happens is there's a feedback mechanism. So when the thyroid secretes T4, that T4 feeds back up to the brain. It tells the brain we have enough hormones. So then the pituitary gland will then reduce how much TSH will be secreted, right? And so it's that balance, that homeostasis that occurs within the body. The hormones are produced. Some of those hormones go back up to the brain. Hey, brain, we got enough hormones. Reduce the amount of TSH being secreted. So if you take T4 hormone, obviously that's going to travel back up to your brain and say everything's normal, okay? So if I have enough T4 in my body, why do I still have low functioning thyroid symptoms? Okay, let's look at the next pathway. That T4, again, it's got to bind to that globulin, that binding globulin, that protein, because remember, the protein's the taxicab. So it's got to bind to that globulin to where that T4 can now be taken to the gut, a little bit to the liver, a little bit to the lungs, again, to be activated into T3. So what happens if you have a deficiency in that binding globulin, which is made in the liver? Well, that means that you're not going to be able to bind the T4, get it into the bloodstream to travel throughout the body. Well, again, so can that affect T4 levels? Absolutely. So if you're looking at T4 and T4 is low, right, and TSH is high, and you have a binding globulin deficiency, will that deficiency be fixed by just jamming more T4 in your body via a medication? And obviously the answer is no. So how do you look at that marker? Well, T3 uptake is kind of an inverse way to test that binding globulin, thyroxine binding globulin. Thyroxine is the name of T4, thyroxine binding globulin. So you can kind of look at that inversely by looking at your T3 uptake, okay? But again, if there's a deficiency there, we need to look at liver function, okay? So if there's a deficiency there, you can still have low functioning thyroid symptoms, even though TSH is normal, okay? So again, thyroxine binding globulin then grabs that T4. It travels to, again, mainly the gut. And now you're going to activate that hormone into T3. Now, a deficiency in the binding globulin, obviously you're not going to get enough T4 to the areas where you activate it into T3. That can affect your T3 levels. But at the end of the day, if you have normal T4, normal TSH, and T3 is low, right, then you have a conversion issue. You're not able to convert that T4 into T3. So why is it that I'm having a conversion issue? Well, it can be number one, because you're not getting the T4 to your gut to activate, or you can have a major gut issue. Well, guess what? Most of Americans, most people, because of the diet, the stress, the things we put in our body, the lotions and potions that we put on our skins, our gut health is devastated. And so now you have so many gut issues, your liver's not healthy, right? You're not able to convert, cleave off one of those tyrosines to convert the T4 into T3. So if you have enough T4 because you're taking medication, which is normalized in TSH, but you can't activate it into T3, you're going to have low functioning thyroid symptoms. How many of you guys have normal TSH, normal T4, but you're not testing T3? So you don't know what your T3 is, okay? Now, we have normal TSH. We have normal T4. We have normal T3. I see this all the time. Why do I have low functioning thyroid symptoms? Remember, the last part of the puzzle is that T3 needs to bind to the receptor site so it can get inside the cell so that metabolic activity can take place. Well, guess what blocks that from happening? Inflammation. How many of you women watching this video, or how many of you people watching this video, have inflammation? Most of you, okay? So that inflammation, most commonly caused by an autoimmune condition called Hashimoto's disease. Now, this is not some of the time. All the other factors that I talked about, from your brain secreting hormones to tell your thyroid to secrete T4, that T4 being converted into T3, most of the time the problem occurs after T3 is activated. And you're like, well, oh my gosh, how am I supposed to know? Well, again, there's antibodies you can test. There's medical tests for everything, just about. But you can test, there's 2 different antibodies you test for. And I can put links or comments or some things in the comment below so that you can, so you have what the thyroglobulin antibody, the TPO, and the antithyroglobulin antibody. These are the antibodies that you use to test for Hashimoto's disease. But Hashimoto's disease, this is what my mother dealt with. She didn't have a thyroid problem. She had an immune system that was attacking her thyroid. Now, I'm not going to go into the details about how we're able to arrest autoimmune diseases, how we're able to make sure that immune system gets back to normal function. But at the end of the day, the latest research is showing that autoimmune diseases are becoming the #1 cause of death, right? Especially in females. Our immune systems are starting to tag different parts of our body as a foreign invader. So my mother's immune system saw her thyroid as a foreign invader. See, the problem is for 30 years, her doctors ignored the problem, didn't even test to see what the problem was, continued to give her thyroid hormones. And so most of her glandular tissue, her glandular thyroid tissue, was replaced by scar tissue, because that's our body's healing tissue. So she caught it too late to where she has to take thyroid hormone replacement, right? Because her thyroid is so jacked up, it's so full of inflammation and so full of scar tissue that it can't secrete enough hormones. But we've positioned her body to be able to activate those hormones. We've eliminated all the abnormal inflammation. So now those hormones could bind to her cells, and she's symptom free and feeling great, because we've made sure that every step along the way is functioning the way it's supposed to function. So ladies out there, and I know there's a lot of guys out there as well, hypothyroidism not treated properly, which more times than not it's not treated properly, leads to things like heart disease. It leads to things like high cholesterol. It leads to things like diabetes, right? It leads to things like obesity. When your body doesn't have proper thyroid hormones, or your body's not able to bind those hormones, or in the small cases where your thyroid just isn't secreting enough hormones, medications might be part of the answer. Medications may not be the answer at all, but there's a reason why you're feeling the way you're feeling. And if we can unravel and look at all those different pathways and look at all those different steps, most of the time you're going to find that there's inflammation blocking that cell. So now it takes more investigation. Why do you have an autoimmune condition? Why is your body rampant in inflammation? Is it foods that you're putting in your body? Is it GI infections that you're dealing with? Hormone imbalances, nutritional deficiencies? What is it that's causing these inflammatory responses? Guys, and that's what I do. You have to find a doctor that first understands the pathways, but then once we can pinpoint the problem, how do we resolve that problem? So listen, a lot of people out there know where to go get thyroid hormones, but there is not a lot of people out there that know how to get their problems resolved when it comes to their thyroid symptoms. So guys, listen, subscribe to my channel first and foremost. Share this video around, share it on Facebook. There's so many people like my mother that struggles, and it's not in your head. There's a problem with your physiology. It just needs to be treated properly. Guys, God bless. Have a great day. We'll see you next time.